Namaste everybody, my name is Anaya Vasudha. I am a Bharatanatyam dancer based in Birmingham. Today I am so privileged to have been approached by Annapurna Dance Company to be interviewing amazing women of incredible achievements. And today I am going to be interviewing Dr Sumana Narain, a obstetrician by profession who works in the University Hospital of Leicester and is based in Nottingham, where she has also opened a dance school of her own, Lasya School of Bharatanatyam, where she teaches those dance enthusiasts of all ages. So please welcome Dr. Sumana Narain.
Namaste, Anaya. Thank you very much for having me today, and it's lovely to be here and be able to share my views. Thank you.
I'm very excited to be speaking to you today, Dr. Sumana Narain. The first question that I'd like to ask you is, so it is a very intense time for everybody, as it is the pandemic. And as a frontline worker, I'd love to hear about your experiences during this time.
As you said, Anaya, I'm an obstetrician, so my experience is in looking after pregnant mums and babies. But I can speak to you from a perspective of a doctor in general. And as you rightly said, the COVID pandemic is one of the biggest challenges the medical fraternity has ever faced in the recent times. And it's all over the globe. This is very different to the emergencies we deal with day in and day out, or the ones we are prepared for or get trained for. Mainly because of the A, unprecedented nature of this, and B, it presented to us with so many unknowns. Initially, we didn't know much about this virus. We didn't know the mode of spread. And we still don't know why it targets only certain individuals and why those individuals are at higher risk of developing a more serious illness and deteriorating very quickly from it. And most of all, there is no cure. And this is very, very challenging for us. As doctors, we work with fixes. And that's why it's called curative therapy, corrective surgery, and so on. But in this case, there isn't one. All we do is provide supportive treatment for the patients and hope that their body just, responds to it positively and they improve. But sometimes that doesn't happen and the patients deteriorate. And they need the next level of care. And sometimes, they move to a higher level of life support, and we're not sure whether they're going to come back from it ever. So to see this and almost have that helpless feeling of watching your patients deteriorate and not knowing whether they're going to get better is extremely distressing. And to do this day in and day out and go back for more the next day, not knowing what the next day would bring us, requires a high amount of mental strength and resilience.
That sounds really, really intense. And the one thing that I'd really like to know about this is, how was it for you emotionally during this time?
To be honest with you, it was extremely challenging and it was quite dreadful. The worst part of this is you go through these things at work, but you can't share all of the details of this with your near and dear ones, mainly because you don't want to scare them. You want them to be positive. But at the same time, you want to take the precautions seriously and you want them to be cautious. Striking that balance was been extremely difficult. And obviously, you're constantly worried about your near and dear ones. You're so worried that you're not going seeing them, especially the elderly relatives who have got health issues. Say, for example, in my case, I haven't seen my parents in well over a year. And that to me is extremely challenging. But I'm also constantly worried about them. The last thing I want to do is spread it to them. You're working in a very high risk setting. And the last thing you want to do is, spread this dreadful virus to them. So all these things are challenging. And also, simple things like you can't come and hug your kids after you have had a very stressful day at work, or before you go through the whole, ritual of sanitation. And of course, there are physical aspects to it, like staying at work, very long hours of exhaustion. staying in PPE, obviously you can't drink, so you get dehydrated. The mask, which has become like a second skin to us, the bruising you get at the top of your nose here from wearing the mask constantly, or the breaking of the skin at the back of your ear starts bleeding, or just the sheer annoyance of having to wash your hair so many times that you have barely got any hair left. All these things are annoying, but can be fixed. But the emotional scars run deeper, and of course you can't see them.
It is an absolutely crazy situation to be in, and I mean, there are so many scary things to come out of this time. But the other thing that I'd like to know is, has there been any positive things to come out of the situation?
Yes, there were lots of positives. Not all was gory as this. The support we got from the community was tremendous. All the clapping, the messages, kept us going. Even simple things like the patients used to stitch us scrubs. We still have, variety of colored rainbow hats I still wear to work. But obviously that kept us going, and it's something to look forward to every day. And I should say, I'm very proud to say that I have worked right through the pandemic, and I have not missed a single day at work. And for me, the personal highlight was also running the Rainbow Service through this pandemic. Rainbow Service is a specialist clinic we run in Leicester. So here we see women who have had a previous pregnancy loss and are subsequently pregnant in their next pregnancy. So we see them at the beginning of the pregnancy. We make, understand what happened in the previous pregnancy, make appropriate plans, and care for them throughout the pregnancy. So I scan these women at regular intervals, giving them treatment, and not just medical treatment. We offer emotional support. So we give that emotional support for them to be able to get through the pregnancy and have that confidence to go through the pregnancy. And we follow them up all the way right towards the end of the pregnancy till the baby is born. And as you can imagine, going through another pregnancy, having had a previous loss, is extremely stressful, and it's so challenging. And on the top of it, to have the pandemic was extremely distressing for these women. But during the pandemic, I'm happy to say we carried on with the service. And in fact, we have two clinics which runs in Leicester. We merged both of them, and having taken the lead for this, I saw these women face to face from both the clinics, and we managed to keep the service going even during the height of the pandemic. And I should say I'm very proud of that personally.
The community could thank the NHS workers enough for the amazing things that they are doing for us, the way that you are literally risking your lives to keep us safe and to ensure that we continue to be safe. I also wanted to say the amazing contribution of the BAME community to the NHS, the South Asian doctors, and all the people who come from overseas to work for the NHS, who are also working so hard to make sure that we are all safe and healthy. And I'd love to hear your comment on that.
Thank you. Yes, the NHS would never have survived this pandemic without the contribution of the overseas healthcare professionals. And South Asian community has made a huge contribution in this regard. Not just doctors, we have nurses, midwives, technicians, HCAs, cleaners, reporters, and everybody has given their selfless service to this cause. Despite knowing that the South Asian community is one of the highest risk groups in getting this illness and more severe form of illness and even dying from this, we have given our selfless service. I have not seen a single South Asian healthcare professional who has shrugged away from their responsibility. So this cannot be forgotten. And I'm definitely a very proud BAME doctor working for NHS.
Thank you again, Dr. Sumana, for the amazing contribution to the NHS and towards all of our health and safety. I now want to talk a little bit more about your artistic side. So you are a trained Bharatanatyam dancer. You were trained under Guru Srimati Geeta Anantanarain of the Geetanjali School in Bangalore. And I would love to know about your journey, especially the fact that you have opened a dance school in Nottingham itself called Leicester School of Bharatanatyam.
So thank you, Anaya. We just spoke about the emotional turmoil I went through during the recent pandemic. And I can honestly say dance has been my refuge throughout, and it's been my escape, and it has helped me stay sane and positive. And dance has been a part of my life ever since I started, right from my childhood through my medical schooling, maybe coming here, trying to build a career here, our initial struggles, or having kids. Dance has never left my side, and it's always given me immense pleasure and happiness. And I feel what could be a more gratifying way of spreading this joy than teaching? And that is my little service to this divine art form, which has given me so much. And also, secondly, as an immigrant trying to raise my two kids up here in another country, I found that there are huge gaps in them accessing their roots and understanding their culture and heritage. And I find that dance is an excellent artistic way in bridging this gap and help them explore their culture and heritage. So as you said, I teach dance during the weekends when I have free time, or some evenings when I'm free. And I see kids, and not just kids, even mature students, come in with some sort of curiosity, but then get really interested and blossom into beautiful young dancers. And I find this very gratifying, and it gives me immense joy and happiness.
I think it's absolutely brilliant that you are running a school for these children, and really providing them a way for them to access this beautiful culture. Amongst your insanely busy schedule as a doctor is absolutely inspirational, and of course I'd love to hear more about that. But the other thing that I would like to ask you is, about the benefits of dancing on the body from like a medical standpoint. I'd love to hear that.
I feel women face a lot of health problems throughout their lives. Starting from puberty, some of them have hormonal changes, childbirth, and right through menopause. But I also believe that dance has an excellent potential to overcome some of these health problems and make women lead a very healthy and happy lifestyle. So we all know the physical benefits of dancing. It helps us to lose weight, tone the muscles, and in case of women, especially the pelvic floor muscles, and especially in women who have had kids, the pelvic floor muscles can become quite weak, and dance helps these to tone these muscles and work on the core strength. And apart from the physical aspects of it, the mental benefits are far too many. We know that dancing, even half an hour a day, can make women completely de-stress themselves and transform them to a much happier individual. And from the medical point of view, if we talk about dance, the benefits are far too many. We know that dance improves cognition, memory, and we talk about gross motor and fine motor skills in medical terms, and these are greatly improved by dance. Balance, coordination, I can keep going on all day. In a nutshell, we know from statistics that women who dance regularly are at low risk of developing dementia, depression, and a wide variety of neurological conditions. With all these benefits out there, I urge every woman to dance regularly.
It is so brilliant to hear about these benefits of dancing for people in general. And me coming from a sports therapy background, so I studied sports therapy at university, and and we also, had to learn about all the benefits of physical activity and such. And I always applied that logic towards dance. So it's really, really cool hearing hearing your what you have to say about dance in terms of how it's medically beneficial for people, especially women. And speaking of women in dancing, it can be difficult sometimes for us for women to pursue a dance career, as there are quite a few barriers for us. And I want to know how you address these issues.
I feel there are quite a few barriers and stereotypes the women face. And I feel some of them are imposed by the society, and sometimes these can be self-imposed as well. Say, for example, I have had people ask me that I'm a full-time professional, I'm a doctor, and so you can't dance. That's the common question they ask. And I have had mature students who come and tell me, oh, I'm too old for this. I have got grown-up kids. What will people say? All these things. So I feel that I feel like challenging them. And I feel that with the right amount of passion, hard work and commitment, we can overcome these barriers and break these stereotypes and pursue what you really want to do, and pursue a dream. And those are the stereotypes I want to challenge, and that's the message I want to get across to women today.
Of course, as you know, in these series of interviews, the overall theme has been, what is it that we choose to challenge? And you're challenging these stereotypes. You've already answered my next question, but it's really powerful, especially those who are trying to pursue a dance career. It's difficult, especially when we're not taken very seriously. When art is something that really gives life to a lot of people. Like you're saying, it has kept you sane throughout this entire COVID pandemic, and it has given joy, and it has caused curiosity, and has given people a connection to culture, especially those who are young, and or doesn't actually matter what age. It's something that is for everyone, this beautiful art form. And and that brings us to the end of this interview, and so happy to have spoken to you today and heard what you have to say. And you are such an inspirational individual, and thank you so much for coming to speak to us today, Dr. Sumana Narain. It has been such an amazing privilege to speak to such an amazing, hard-working individual. And it has been a very incredible learning experience for all of us, myself included. And very, very grateful that you have been able to join us today. And wishing you all the best in everything that you're going to be doing, which sounds absolutely inspirational. But in your dance, as well as as a doctor, thank you so much.
Thank you so much for having me here today, Anaya. It was lovely talking to you, to such a talented, enthusiastic and young individual. It's been my honor and pleasure. And thank you very much, Shanta Rao from Annapurna Dance Academy, for giving me this opportunity to be able to share my journey to the viewers. And very happy International Women's Day to all of you. Thank you. Namaste.
Thank you.